we will upload مرة ثانية نشوف شو المشكلة ليش كذا بطيئة. اوكي شباب، واضح يا شباب؟ نبدأ.
واضح يا دكتور.
يلا. Today our lecture will be about vascular surgery, acute and chronic limb ischemia. Usually when you are talking about ischemia, that means is a way that the blood supply that's reaching the organ will be decreased. Usually it appears as a stenosis or occlusion. Stenosis means the diameter of the vessel will be less than normal. Occlusion, this means obstruction of the vessel itself. Usually the most common cause is either due to atherosclerosis or emboli or trauma. This occlusion or stenosis will appear as a symptoms on the patient lower limb, either as claudication, wrist pain, and gangrene. What claudications mean? Claudications, it's a pain that happens or occurs in the calf muscle when the patient walks. This is due to the ischemia that happens during walking to the muscle. It's a way that the lower limb will express its blood supply, or it's a way to express that there is a decrease in the blood supply that's reaching the lower limb. Stenosis or occlusion can occur in other organs like the brain, to appear like stroke, in the heart to appear like MI, in kidney to appear as renal hypertension and renal failure. الحين ما براضي يحمل هذا. طيب. Also lower limb decrease in the blood supply will also be seen in small bowel. Small bowel, it will be the symptoms will patient will come with abdominal pain, sometimes distension and bloody diarrhea. The most important thing to put in your mind that these patients, the symptoms will occur according to the type or size of the artery which being occluded or stenosed. And also another thing, is it an acute or chronic? أنا فيصل يسأل يقول في صوت ولا لا؟ أنا الصوت واضح عندي.
الصوت واضح يا دكتور.
صوتك واضح بس ما
إيش بالله الله يرضى عشان ما أبي أقطع كل مرة المحاضرة. سويت شير السلايدات وما هي بقادرة. ما بقدر الحين المحاضرة طويلة.
ارجع احذفها يا دكتور وارجع نزلها، بعض الأحيان السيستم يعلق.
ممكن. طيب خلينا
أو ارسلها لنا على الميل، أقدر أسوي شير أنا مثلا من عندي ولا أي واحد من الشباب.
طيب.
ما تقدر تسوي شير يا إياد لأنك مودريتور.
ايوه يمكن يغيرني الدكتور.
خليني أجرب مرة ثانية. اليوم رفع حمل مضيع.
دكتور بالنسبة للحضور يؤخذ تلقائي أو كيف؟
اي تلقائي مثل ما شرح لكم الدكتور أحمد قبل.
لأني أنا الحين ما كان عندي صوت وطلعت ودخلت.
عادي إلى أول 20 دقيقة من المحاضرة، بعد 20 دقيقة يصير في غياب. ما أدري ليش ما راضي يسوي شير المحاضرة. أرسل لك المحاضرة يا عبد الرحمن في الواحد دقيقة. أيوة خلاص كان مشكلة. اوكي واضح الحين يا شباب؟
نعم يا دكتور.
يا دكتور
أيوة.
واضح واضح جدا.
مثل ما تكلمنا عن intestine will be as abdominal pain and infarction and small bowel ischemia. Usually, the symptoms appear according to the size of the artery involved, or is it an acute or chronic. In a chronic condition, usually the chronic narrowing vessel causes an appearance of something called collateral circulation. ايش معنى collateral circulation؟ بالعربي يعني تحويله، يعني main artery is being closed, so there is a new vessels or new small vessels around or the side of the main vessel that will deliver the blood supply. The problem with these vessels, the weak blood suppliers. So whenever there is a stress, the blood supply will be less, and these collaterals will be not effective. ما بواضح يا عبد الله السؤال. طيب features of chronic arterial stenosis or occlusion in the leg, it will appear as intermittent claudication. What does it mean, intermittent claudication? It is a pain that occur in the calf muscle during walking, and it will stop when the patient relax. It is a crampy like pain felt in the muscles that brought out by walking, not present when the patient is walking in the first step, which is differential diagnosis of osteoarthritis, relieved by standing still, and unlike nerve compression from lumbar intervertebral disc prolapse or atherosclerosis that become worse when the patient is standing still. عشان كذا شباب هنا differential diagnosis اللي يتكلم عليه أمس، يجيك البيشنت العيادة يقول أنا عندي pain in the calf muscle. Unless you don't know where is the cause exactly, you will not be able to treat it very well. Is it from the muscle? Is it from the nerve? Is it from the bone? So by taking a detailed history, it will give you more hint about the possible cause. One of your things that should be covered during taking history is the distance of the patient will walk till he start having the symptoms. Why? This will give you a hint about the patient condition. If he tell you that before 1 year I can walk like for 500 meters without pain. Now when I walk for 100 meters, I will start having the pain. That means the patient condition becoming worse, and his blood supply or his vessels are being narrowed more and more. That means this patient is having the condition since chronic since a long time, and it should be investigated thoroughly to know, is it due to vessels, is it due to cardiac problem, or is it due to anemia. Usually the pain of the claudication is felt at the calf because the superficial femoral artery is the most affected. 70% aortoiliac diseases, aortoiliac diseases, which are 30%, will cause a pain in the thigh or buttock. Buttock claudication is association with sexual impotence resulting from arterial insufficiency. الفكرة في السلايد هذه to tell you that whenever there is a big artery or a big vessel involved, it will affect all the area around it. If it's the femoral, it will affect the lower limb. If it's the aortoiliac, that means it will affect all the area which is below the aortoiliac. يعني من الأورطة connection between the iliac and the aorta, what is below it will be affected, either muscle, either nerves, either sexual function. One of the symptoms that the patient may come to you complaining of is wrist pain. Wrist pain it is a pain that occurs in the lip when the patient is relaxing or at rest, and usually it's felt in the foot and felt in the calf muscle. It's exacerbated by laying down or elevation of the foot. Characteristically, the pain is worse at night, and it may be lessened by hanging the foot out of the bed or by sleeping in a chair. The pressure of the bed clothes on the foot usually makes the pain worse. وش معنى الريست pain? It is a pain that occur due to the decreased blood supply. عشان كذا يا شباب لو تشوف it is being exacerbated when you lay down. When you lay down, the blood, the delivery of the blood to the lower limb will be less, but it will improve when the patient hang his lower limb on the bed, because the return or the blood will be more in the lower limb, so the craving for the blood will be less. طيب. One of the complications that patient can come, يعني أحيانا البيشنت ما يجيك لا breast pain ولا يجيك claudication, but he will come as a complication of the lower limb ischemia, which is ulceration and gangrene. These ulceration and gangrene, usually it is due to arterial insufficiency, and sometimes it will be painful or painless. It is an unhealing ulcer on the dorsum of the foot and around the medial or lateral malleoli. Usually once this gangrene starts to become black, that means it is becoming gangrene, and there is a bacterial infection. Usually it will be associated with it. إذا بغينا اللي بيقرأ بعدين عن types of gangrene, there is a dry and wet gangrene. Dry gangrene, it's a gangrene that occur without signs of infection, and usually dry gangrene is a chronic condition. Wet gangrene is a gangrene that occur acutely or associated with infection. احنا قلنا part of the assessment is history and examination. You are examining a patient with lower limb ischemia. Usually the foot will be cold. If it's an acute condition, the foot will be cold, it will be paralyzed and decrease in the sensation. In a chronic limb, usually there will be no changes because there is a collateral blood supply, so the temperature will be not like acute. It will not be cold, it can be warm. Usually the paralysis and the insensation that occur with the acute condition in a chronic patient due to the collaterals, it will be less. ليش السؤال ليش الكرونيك in a chronic ischemia the patient sensation and paralysis will be intact مع انه هو ischemia.
ما في
collateral circulation will be improved.
طيب collateral هذه كويسه، وهذا انا قايلها. لا انا ابغى اعرف what is the blood supply of the nerve that makes the sensation and the paralysis not occurring in this patient.
Because it's chronic, affects the smaller arteries, unlike the acute.
اوكي small arteries. طيب الحين سؤال نحوم حول الموضوع احنا، لكن الفكرة احنا النيرف in lower limb ischemia is affected or not? Hi Shabab. The nerves in the lower limb, are they affected by ischemia or not?
Yes, affected دكتور. أتوقع عشان الكولاتر artery ما تغذي النيرف.
No.
English guys, it will not affect. طيب how they will be affected? What is the name of the تفضل يا علي. What's the name of the blood supply of the nerve? النيرف من وين يجيب blood supply يا شباب؟
Micro circulation.
Maybe there will be
muscle
vascularization with the time.
شباب بيسكس، ترى هذا سؤال ذا بيسكس يا شباب. What's the blood supply of the nerve؟ شو اسمه؟ ليش مرضى الديابيتس they will have tingling sensation؟ ممتاز إياد، كويس ممتاز. فازا نيرفوزا ممتاز. طيب هذه بيسكس يا شباب. عشان كذا once there is any decrease in the blood supply of the nerve, in the blood supply of the nerves, the first thing will be affected is the nerves. لأنه الفازا نيرفوزا very sensitive vessels regarding decrease in blood supply. عشان كذا قلت لي دائما تلاحظ أول ما في يصير أي decrease in the blood supply يقول لك أول ما حسيت فيه tingling sensation, numbness, especially in the acute condition. طيب upon examination, also when you are examining the lower limb, any raising the lower limb above the bed, the patient usually will be having a paler changes of the limb, which will become better when he is hanging it down. Usually, one of the things that will give you a hint about the situation in the lower limb is capillary refill. In capillary refill, usually it takes from 2 to 3 seconds to appear, but once it is prolonged more than 10 seconds, it means that the patient is having severe ischemia. And also don't forget to add with it saturation of the lower limb. Saturation, what's the saturation? You are attaching the saturation device to check the auto saturation in the lower limb, which is one of the things which will be affected in lower limb ischemia. طيب طبعا كل اللي نتكلم عنها يا شباب هذه اللي هو بيجينا when the limb ايش؟ ما واضح السؤال. when the limb is elevation the limb will be called. ايش رايك يا محمد؟ احد يجاوب يا شباب.
In case of what طيب دكتور limb elevation؟
ايه؟
يعني
in case of ischemia يعني.
انا ما ادري انا من البدايه شرحت الكونسبت عشان لما احد يسال يعرف what does it mean the concept. عندك patient the blood supply is not going to the lower limb and you want to encourage the blood supply to go to the limb. What's best, to make the lower limb hang on the bed or raise it above the bed? easy يا شباب.
not hang.
hanged on the bed.
hang on the bed علشان يزيد البلد سبلاي.
شكرا لكم يا شباب. يعني هي فيزياء ترى. انت الحين you are using the gravity to encourage the blood to go to the lower limb. Once you raise it up, the lower limb the blood supply will be this.
You will make it worse.
So it will become colder. Yeah.
It will become colder. الفكرة يا شباب أنا عشان كذا تلاحظون تكلمت من البداية أول ما قلت depend according to the size and is it acute or chronic. تلقى مريض له 30 مو 30 يعني له عدة سنوات وهو عنده له chronic limb ischemia and he know how to deal with it. يعني يقول والله يا دكتور أنا لاحظ إني مثلا إذا مني جتني الأعراض I can treat it in a way that I راح أنزل رجلي السرير أنزل ما أرفع رجلي على السرير. يعني عشان كذا أنت شوف أنت you are not treating you are treating only the symptoms of the patient. والله يقول لك والله يا دكتور أنا كانت أموري زينة وأحط رجولي وأعلقها المكان اللي أبغاه ما عندي symptoms. Suddenly I started to develop an acute numbness. هذا أنت you should treat the acute condition. لكن some patients they are old age since long time they are having this chronic insufficiency and they are living with it. But it become worse when they do an extra effort. فعشان كذا هذا الانترفنشن للأكيوت يختلف اختلاف كامل عن الانترفنشن للكرونيك. اوكي لانه احيانا الكرونيك الموست كومن كوز حقه لو واحد ركز على السلايدات it is cardiac disease. يعني معناها انه whatever what you will do to the lower limb it will not improve. You need to improve the pump which is the heart. طيب arterial pulses, examination of the lower limb اللي انشرحت قبل. Usually you start your examination starting from above, which is the femoral and popliteal, posterior tibial, dorsalis pedis, to check the pulse and to check the relation with the opposite or opposite limb. Once you feel it, for the examination of the lower limb. حاجة practical عشان لما الواحد دائما يقرأ يعرف. طيب patient coming, most common complication of lower limb that patients come usually لو بنشوف بعدين يدينا المستشفى is diabetic foot. Diabetic foot patients, they have a systemic problem which is affecting their vessel, their nerves, their tissue healing. So the most common complication related to the arterial problem that patient with the foot, they will come either with gangrene or ulcers. So if a patient coming with gangrene, according to your assessment of the arterial pulses, you will be able to determine which level the patient will need amputation. فهمت الفكرة شباب؟ هذه الفكرة إنه if you are able to feel the popliteal, that's mean the amputation should be below the popliteal. If you cannot feel the popliteal, that's mean the amputation should be above the popliteal. لأنه if you are unable to feel the pulse properly, معناها there is no blood supply coming to this area. So whatever intervention you will do, it will not heal. يعني بيجلس الجرح ما يقفل.
طيب بس دكتور البابليتيال، دكتور شميم ذاك الوقت كان يقول انه it's hard to feel the popliteal pulse.
it's hard لما يجيني واحد وزنه 150 ولما يجيني واحد انا عنده previous problems. لكن لو جاني واحد young I can bend the knee properly and he's having a good circulation, you will be able to feel it. النورمال راح تحسه. لكن احيانا في اشياء معوقات. صحيح patient عنده knee swelling, patient obese, you will have difficulty to find it. عشان كذا في اشياء
بشيك على الاذر ني عشان اعرف هل هي بلس ولا لا.
check the other knee. If it's a systemic problem, you will not be able to feel it bilaterally. If it's a unilateral problem, you will feel it in one limb and you will not feel it in the other limb. Okay? Usually once you are assessing, مثل ما قلنا, once you are assessing the pulse and you are unable to feel the pulses distally, that's mean the blood supply which is reaching the distal part of the organ is not reaching. يعني انت you think that the patient is having possibly an occlusion in the femoral artery. Usually the pulses after the femoral artery will not be popliteal, posterior tibial, dorsalis pedis. لكن if you are unable to feel the femoral artery but you can feel the popliteal and the posterior tibial, معناه ان the femoral artery is palpable لكن you are unable to find it. لانه اذا كان weak, اذا بدا من الاوريجن صار weak, كل ما بعد الاوريجن will be weak. لكن اذا كان الديستال بارت palpable والبروكسيمال not palpable, معناه انك ما لقيته زين. لانه usually the distal part will be, يعني arteries لو تذكرون anatomy, whenever you go distally the artery will be weaker, will be more directed. طيب نفس الكلام اللي قلت هذا سلايد. طيب في شيء في الاكزامينيشن ايش اسمه يا شباب؟ تذكرون ايام شيء اسمه بروي وثريل؟ احد سمع الكلمات هذه؟
اسمه دكتور
بروي اند ثريل. احد سمع عن الشيء هذا بشيء اسمه في الاكزامينيشن بروي اند ثريل؟ طيب
ايوه دكتور.
مهم جدا يا شباب، مهم جدا يا شباب. الاكزامينيشن اوف دور لمب it is about زي تذكرون او يمديكم ايام البريست، هي عباره عن inspection palpation، لكن تتعلها بطريقه اللي look feel. One of the things that during assessment of the feeling of the lower limb is something called بروي and thrill. شباب البروي T silent، لا حد يدخل عليه في الستيشن ويقول لي برويت، اسمها بروي T silent. It is طيب how can I assess the بروي and the thrill؟ بروي it is the movement of the blood within the vessel. It will be assessed by the stethoscope. Thrill it is movement of the blood in the blood vessel. It will be assessed by palpation. هذه طريقتها يا شباب. طبعا يعني
انيوريزم
مو بانيوريزم، لا مش انيوريزم. اللي قرأ abdominal examination يعرف انه once you feel this، الفكره ما ابغاك تضيع وقتك انه كل بروي او ثريل معناه انيوريزم. احيانا هايبر دايناميك سيركيوليشن patient will have بروي and thrill. And patient with hyperthyroidism and thyrotoxicosis they will be having بروي and thrill. فلا تدخل امورك في الاشياء، لكن عشان بس نعرف الكونسبت اللي يقرا بعدين. usually بروي and thrill is seen with patient with arteriovenous fistula. الارتريوفينس فيستولا هو عباره عن ما هو بانيوريزم. It is a direct communication between the artery and vein. عشان كذا ترى البروي والثريل اذا فهمت الكونسبت you will be able to apply it. It is هي يسمونه hyper dynamic circulation يا اياد. طيب مثل ما قلنا هذا عاده features of chronic lower limb ischemia either to have interventional indication, wrist pain, sunset foot. عبد الله تفضل. ulceration, gangrene, there will be no pulses, arterial بروي and slow capillary fill. هذا بس تجميعه when you are assessing. في صوت يا عبد الله بس المشكلة عندك. شاب ردوا على عبد الله، حد يرد عليه يقول
هو يسأل. لا هو يسأل يقول الثريل ساوند، يعني لأن الثريل اللي قلت قبل شوية يبان في البالبيشن والبروي يبان في الاسكوتين.
طيب البروي اللي يركز على البروي heard on auscultation over the pulse. البروي عبارة عن machinery movement of the blood in the vessel. You will be able to hear it by stethoscope. This is the بروي. The thrill you will be able to feel it. Okay. واضحة. طيب. This is one of the complication of lower limb ischemia, which is Blacke's discoloration of the toe. طبعا في الإكزام حطوا في بالكم يا شباب. Yes, يا عبد الله. نعم. The sound of the thrill is a بروي. A thrill you will be able to feel it. The بروي you will be able to hear it. طيب one of the ways to examine the patient. تفضل يا عبد الله. شباب عشان المقاطعة أي أحد عنده سؤال خلوه آخر شيء عشان نخلص. One of the things you may have during your OSCE exam ممكن نجيب لكم صورة picture and we will give you some scenario. We will give you some scenario and according to it you will specify what is your assessment and what is your differential diagnosis. يعني زي هذه الصورة. I will bring you a scenario. طبعا فيصل is it dry or wet gangrene from a picture. يعني احنا عاد الفكرة أنا ما أختبر مدى قوة نظرك. أنا I will bring something it will be clear. في صور ثانية راح مو بلازم تجي الصورة هذه، لكن أنا الفكرة عندي إنه to know how to describe the picture. There is a blackish discoloration of the fifth toe of the left foot, which is extending the mid of the finger and reaching to the dorsal part of the foot. It is 3 by 3 centimeter, associated with red discoloration around it. خلاص. What is my differential diagnosis؟ نتكلم فيها بعدين. هذا الهدف يا شباب. Once there is a red discoloration around it, it will be غالبا wet. طيب. هي نفس الفكرة نتكلم إنه once the symptoms according to the level of the vessel which is involved, the patient will be having symptoms. If it's involving the iliac or the femoral popliteal, according to that the patient will have symptoms. هنا لما كنا نتكلم قبل شوية according to the level of the obstruction. طبعا one of the things that you should be covered during history, and you should search for the risk factors. Patient is a smoker, hypertensive, diabetic, hyperlipidemia, and how is these medical conditions, are they well controlled or they are not controlled? Once the patient stop this or try to treat these risk factors and they are not improving, usually symptoms should be treated in a way that will make his life better. يعني patient عنده wrist pain and he cannot continue his life with his wrist pain. So I will find, is this wrist pain due to the obstruction or stenosis, and according to it I will do my intervention. What I mean that if it's wrist pain due to stenosis, I will take him for intervention radiology. I will put stent. Once you put stent, that's mean the blood supply which is reaching the limb distally, it will be better. So the wrist pain will decrease. If he is having an occlusion that you cannot put a stent, the best intervention for him to do amputation. طيب. تذكرون أول شيء أول ما تكلمت عن ال level of obstruction or stenosis that can happen in the arteries. If it's at the level of aortoiliac obstruction, patient will be coming with claudication in the buttock, and the thigh, and the calf. If it's femoral and distal, the femoral and distal pulses will be absent in the lower limb. There will be bruit over the aortoiliac lesion. Patient may have impotence. If it's an iliac obstruction, unilaterally مثل ما قلنا يا شباب. If it's unilateral, there will be claudication in the thigh and the calf, and sometimes the buttock. Bruit over the iliac region and unilateral absence of the femoral and distal pulses. أنا الفكرة اللي بوصلها لكم هنا إنه according to the level of the obstruction, all the things distally will be affected. In the femoral popliteal obstruction, unilateral claudication, femoral pulse will be absent. Distal obstruction of the femoral artery pulse, and if there is any obstruction, the ankle pulse will be lost, and there will be claudication in the calf and the foot. Once you know the level, everything distally to it will be affected. Once you know the cause and what's the pathology exactly, you will be able to do your intervention. Either you will put a stent or you will do for a surgery. A general investigation usually that will be related to the patient physical status, and if there is any cause of atherosclerosis should be asked. Trying to find what are medical problem or age-related problem that may cause this problem. If he is having a cardiac ischemia or COPD and malignancy, it should be managed. Sometimes patient can come with acute ischemia due to malignancy. Patient is having a cancer which is showering an emboli, in the body, one of the emboli was impacted and it caused ischemia. Usually دائما the patient with malignancy they have hypercoagulable status. ايش معنى hypercoagulable status? These patients they are at risk of developing easily thrombus and emboli and showering it around the body. Right. A blood test that is related to the vascular problem, you will assess for anemia, diabetes, lipids, renal problem. Most important thing to assess the renal function. If the patient is having decreased renal function, it should be treated well. And according to that, you will plan your intervention. Any patient coming with renal problem and he is having an occlusion or a stenosis, you put in your mind in doing any intervention with usually intervention radiology, it will affect the kidney more. Why? Because you are injecting a contrast to see the vessel properly. في صور راح أحطها لكم. When you are injecting the contrast and the kidney is not working, you will make the kidney worse. فدائما يا شباب planning the decision for intervention, you should put in your mind the whole physical status of the patient. طبعا don't forget to assess the patient by doing ECG, and if the patient is having cardiac problem, you can do echo. If the patient is known case of lung, assess the lung function, do blood gases. طبعا one of the way of the assessment of the الصورة هذه بس بحاوريكم إياها دقيقة. هذا الدوبلر اللي بنتكلم عنه الحين. Doppler ultrasound Doppler ultrasound, it's a device that will make you hear the blood which is going through the vessel, and according to it you can assess how the blood is running in the vessel. يعني normal blood vessel will be tri-basic. Average will be or below normal, it will be bibasic or it will be monobasic. ما بكم تهتمون في الشيء هذا بقدر ما تهتم إنه I am using the sound to assess the blood which is going in the vessel. بس هنا حاجة كذا زي physics continuous wave ultrasound يصير through the probe. هذا الهاند اللي تمسكها اسمها probe، في زي البيم. once it is يعني انت you're using the ultrasound, so فكرته انه ultrasound is coming from out of the device and hitting the vessel and coming back according to the reflected ultrasound wave. It will appear as a voice. Usually Doppler you are using it once you are unable to assess the patient, the vessel by palpation. يعني أنت قاعد تفحص المريض. We are trying to palpate the popliteal. The patient is obese and you cannot palpate it. So in this way, you can use the Doppler to assess the lower limb, to assess the popliteal. Once you are able to see it as a triphasic tone, that means it's a normal, even if you are unable to do it. طبعا في بعض الناس they are conjunction doing connecting it with the sphygmanometer. لكن الفكرة إنه the Doppler itself, once you are able to hear voice or the tone of the blood vessel, it will give you an impression about the vascular status of the lower limb. Another way to assess the lower limb vascular status is doing the ankle brachial index. Ankle brachial index في صورة. This is the using the sphygmanometer and the Doppler to assess. هذه الصورة أنا هدفي من الصورة هذه عشان لما أتكلم. طيب What is the ankle brachial index? It is a ratio that you are using systolic blood pressure in the upper limb and the lower limb and dividing it in a way to reach a ratio. Usually this ratio, the normal level, it's 1. Below, that means there is an arterial obstruction. Below than 0.9. Below than 0.5, it comes with pain. Below than 0.3, it is indicated that cause there is necrosis. أنا بس اللي أبغاكم تعرفوا من هذا الشيء إنه this is one of the modalities that will help you to assess clinically the patient vascular limb dystally. يعني معناها إنه أنا once I'm able fear يعني اللي بيفتح في اليوتيوب أو بيشوف how it's done أنت you are taking its ankle brachial index. إيش معنى ankle? So you are doing a divide between the ankle systolic blood pressure and the brachial blood pressure. معادلة معينة. المعادلة المعينة هذه لما تطلع ال blood pressure systolic less than 1, that means the blood supply in this lower limb is being affected and the patient needs an intervention. Usually the ankle brachial index, once it's below the 1, it gives you a hint regarding the patient possibly may have an intermittent claudication or pain. one of the side effects or problems of the ankle brachial index, if the patient is having a calcified lower vessel, patient عنده calcification or atherosclerosis in the distal lower limb, the vein will be, or the artery will be hard, so it will not be compressible. So the patient, you will not be able to assess it properly. طيب. لو تلاحظون في البداية تكلمنا عنه، قلنا we are using الصوت واضح معي شباب؟ معي انتم ولا كيف؟
معك دكتور، واضح
دكتور معك.
واضح.
طيب. لو تلاحظون في البداية when I was talking I talked about Doppler. We are using the sound to assess the vascular status. In duplex we are using a picture to assess the vascular status. It is نفس الفكرة حق Doppler. It is using the ultrasound to assess the blood vessel زي كذا. So it is giving you a picture. If it's giving you how is the blood vessel is working and how is the blood is running through it. طبعا هذه كلها أشياء للراديولوجي، لكن this will give you it will help you to define the anatomy properly. يعني مشكلة الدوبلر إنه لو في أي stenosis راح تسمع الصوت لكن ما تعرفون مكانه بالضبط. لكن الدوبلكس once you see the stenosis you will be able to find it exactly where it's which level is the stenosis. يعني الفكرة إنه it will give you a color and it will help you to where is the anatomy exactly. الفكرة إنه sometimes patients they cannot go for CT or for angio. Doppler can make it easier for you. You use it instead of doing the CT. لكن الفكرة إنه مشكلة الالتراساوند or sorry الدوبلكس sometimes it needs an experienced person to handle it. الالتراساوند نفسه يحتاج شخص expert، ما هو بأي واحد can deal with it. So if it's difficult to find it by the duplex, you can send the patient to do CT or angiogram for better imaging. طبعا الانجيو شباب it's a way that it's an invasive procedure. You're injecting a contrast through the femoral artery or through the limbs so that to delineate what is the anatomy exactly, and the contrast will help you by running inside the vessel and what is it exactly being impacted. You will be able to know which part or which level is affected. The most important thing to put in your mind, and not every patient you should take for angio or CT. unless you assess his physical status. يعني معناه patient should, if he's having any cardiac problem, if he's having any renal problem, he's allergic, يعني these things should be assessed before taking him for angio. نفس الفكرة الانجيو والCT angio والMRI, all these are radiological things that help you in assessment of the arterial status in patient with symptomatic lower limb ischemia. طيب الحين نتكلم عن acute arterial occlusion. طبعا الكل اللي تكلمنا عنه يا شباب سابقا هو it is about how to assess the arterial ischemia and what are the ways of the assessment, what are the radiological modalities. هنا اللي بيقرأ بعدين عن what are the diseases that can be caused by the arterial occlusion. The most important thing to know what are the causes. So if you are able to know the cause, you will be able to treat it and prevent recurrence. أنا اللي حبيت أتكلم هنا عن embolic occlusion, which is the most common thing that come with patient with arterial fibrillation. Scenario كالتالي: patient he is a 40 years old male coming with lower limb sudden onset of lower limb numbness and unable to move his lower limb, associated with change of the color of the foot and the thigh. لو تلاحظون معي it's an acute and arterial condition. It's an acute condition that occurred within minutes. معناها إنه this is not something will be related to the vessel. It is something that caused the vessel or closed the vessel. فعشان كذا very important to assess the cardiac status of the patient. And the most common cause of embolic showering is atrial fibrillation. فالفكرة إنه البيشنت will come to you as a case of lower limb ischemia, بينما الكوز والمين كوز والسبب الرئيسي هو cardiac problem. So you will be able to treat the lower limb, but you forgot to treat the cardiac problem. فعشان كذا شباب حط بالك very important إنه okay I should assess the lower limb properly and try to find the cause. If he is known case of atrial fibrillation, I will find why he is having atrial fibrillation. I will do echo. Is it due to MI? Is it due to a valvular issue? Is he having endocarditis? فمهم يا شباب إنه بس not treating the lower limb. It is about the treating the whole patient issue. طيب نفس symptoms will be whether you will be having pale, pallor, paralysis, pulseness, paresthesia. Usually these patients not have collateral circulation, so these symptoms will appear quickly. لكن some patients once they are known case of cardiac problem and they have and their lower limb is affected since long time, they may develop some collateral circulation. هذا اللي يسأل قبل شوي. This is acute lower limb ischemia. There is demarcation. You can see the difference between the normal and the abnormal affected part. لو جت صورة مثلا you can يعني describe it in a way there is a blackish or discoloration of the distal part of the lower limb involving the foot, which is reaching at the part of the ankle, affecting the all fingers and the dorsal part of the foot. What is your differential diagnosis? Usually it's coming with dry or wet gangrene, لكن by this color usually it's coming with dry gangrene. طيب واحد يقول لي طيب دكتور ممكن الدراي gangrene يصير معاها wet؟ الدراي gangrene معناه انه البيشنت is having no infection، لكن ممكن الدراي gangrene تتحول الى wet لانه الدراي gangrene عباره عن dead tissue bacteria can come and invade the tissue and change it or add with the dry some part of the infection. الفكرة شباب انه غالبا الدراي gangrene it is a mummified limb. يعني لانه dry usually since long time the muscle will be wasted, the skin itself will be ulcered. غير الوت gangrene. Wet gangrene it will be swollen, painful, reddish, associated with infection. Sometimes you will see the pus or the element of infection. فالفكرة إنه يعني once it will come it will be very clear. طبعا هذه في الصورة، لكن في الريل life you will continue your assessment by feeling the pulses. You will feel the warmness of the lower limb. You will feel the tenderness. نفس الكلام هذا إنه you will be able to feel the limb and if there is any redness, warmness, the patient will be able to feel it. If there is any paresthesia, the most important thing to put in your mind إنه شاب in acute lower limb ischemia your cut line is 6 hours. إيش معنى 6 hours؟ يعني you should try to save the lower limb within 6 hours. Once it is more than 6 hours, usually this effective ischemia will be irreversible. نفس الكلام اللي بيقرأ بعدين. Diagnosis is made clinically. Usually the limb will patient come with severe pain and the worm will be cold. According to the level of the obstruction, there will be palpable pulse or not. Treatment of acute occlusion, usually you will acute occlusion, that means there is a thrombus or emboli that closed the vessel. So my treatment is to try to remove the embolus and encourage the circulation by giving heparin. Removing it will be by doing embolectomy. وش هو embolectomy اللي بيفتح النت ويشوف. It is a way that you will assess what is the level, what is the obstruction. You will go to the vessel, you will open it by surgery, and you will find the thrombus. You will bring it out and give the patient after that heparin. يعني غالبا this is with the acute condition, especially with acute lower limb ischemia. طبعا embolectomy نفس الفكرة اللي بيقرأ، إنه اللي بيشوف بعدين إنه embolectomy it is a way in removing and trying to clean the vessel proximally and distally. يعني أنت شلت الثرومبس وتشوف ال proximal part and distal part of the vessel. Is it affected or not? Usually by doing something called balloon and Fogar catheter. يعني ما أبغى أدخل في التفاصيل هذه بقدر ما إنه it is a way of cleaning the vessel proximally and distally. نفس الفكرة. You are inflating and then you are bringing out. You're giving the patient after that anticoagulant, either or warfarin. One of the common complications that occur after lower limb ischemia, acute lower limb ischemia, is compartment syndrome. It's the edema of the lower limb or the muscle due to the decrease of the blood supply. Usually, treatment of this is fasciotomy. A very important thing لما يجيك patient with swollen lower limb. Swollen lower limb after يعني patient will be coming مثلا scenario كالتالي. Patient come with numbness of the acute numbness of the lower limb. The calf muscle is swollen. طيب مهم تحط في بالك what's your differential diagnosis? Is it due to acute ischemia? Is it due to compartment? Or is it due to DVT? فالdifferential diagnosis والhistory will give you a hint. Treatment of compartment is fasciotomy. حاجة بس hint بسيطة إنه acute mesenteric ischemia, it's an ischemia that happen in the bowel due to the occlusion of the blood supply of the small bowel or the large bowel. Patient will come with abdominal pain and distension, vomiting, blood diarrhea. غالبا these things, this patient will be having lower limb, bowel ischemia and need a laparotomy and resection of the small bowel and or the large bowel. وبعدين يعني surgically غالبا انه usually this patient will need a second look. يعني تاخذه first time you will take him for surgery, you will resect the bowel, then you will close his abdomen. Then 24 hours later you will take him again to check that there is no other bowel ischemia occurred due to this thing. يعني هي عملية أكثر يعني assessment الهدف إنه you will not miss another ischemia، لأنه غالبا usually this patient مثلا الاسكيميا تكون في ال superior mesenteric artery or inferior mesenteric artery which is supplying a big part of the bowel. ففي البداية ممكن ما تكون appear واضح، لكن after 24 hours it will be more obvious. يعطيكم العافية. Thank you.
دكتور بس سؤال إذا ممكن.
Any question؟
إيه دكتور is it common يعني this case is it common تشوفه في الهوسبيتال كثير؟ هذا سؤال.
إيه قصدك أيوة الأبدومينال اسكيميا ولا اللور لمب اسكيميا؟
لا اللور لمب اسكيميا.
إيه اللور لمب تشوفونها إذا نشوف مستشفى الملك خالد في حالات دايبتك فوت كثيرة، فغالبا يجونك as a complication of. طبعا شوف انت الحين ما راح تشوف acute lower limb ischemia، لان acute lower limb ischemia راح يجي للطوارئ مباشرة وراح ياخذونه من الطوارئ على العمليات، لكن اللي بتشوف الورد patient coming complication of the lower limb ischemia diabetic foot ulcer gangrene، لكن هي فكرتها واحدة انه due to the vascular problem vascular issue it is common والamputations common، لكن الفكرة إنه how are able to find it and treat it properly. يعني ممكن المريض يجلس عندك شهر كامل في الوورد. دقيقة يا سيف خلني أخلص بس. ممكن المريض يجلس عندك شهر كامل في الوورد وعنده decrease in the lower limb blood supply and you are not treating it. المريض جالس الwound is not healing، فعشان كذا treating patient with vascular problem it is something multidisciplinary. ايش معنى multidisciplinary؟ يعني لما يجي مريض عنده lower limb issue الفاسكولار will be involved، medical will be involved to treat his medical problem. Is it cardiac or is it diabetes or is it hyperlipidemia? If the patient condition shows that he's having insufficient blood supply to the lower limb, you will involve the radiology, the intervention radiology. You will ask their help put stent. فهمت الفكرة إنه يعني هو مو مجرد بس يجيك واحد يقول تريتهم أنت السلام عليكم يطلع، لا يعني البيشنت غالبا تلقاه عنده مشكلة فاسكولار هذه حصلت بسبب تراكمات سابقة قديمة، either cardiac either diabetic either renal. أوكي تفضل يا سيف.
الكومبليكيشن دكتور كومبارتمنت ما عدل
ما فهمت يعني كيف بس الكومبليكيشن؟
كومبارتمنت سيندروم.
ايوه كومبارتمنت سيندروم. طيب كذا للي بيقرا بعدين الكومبارتمنت سيندروم يا شباب تحصل يعني لما المريض يحصل عنده اسكيميا وفجأة وفكت الاسكيميا ورجع البلد سبلاي مرة ثانية، عشان في كلمة في السطر الثاني اسمها ريفاسكولاريزيشن، يعني كذا بالعربي مريض حصل له اسكيميا بعدين فكت الاسكيميا. كيف فكت الاسكيميا؟ جاك الطوارئ اعطته هبارين، اخذت العمليات وفكيت الامبولس، فالبلد سبلاي رجع مره ثانيه لللور لمب. رجعت البلد سبلاي هذه اللور لمب البيشنت حصل عنده اسكيميك انسولت، يعني البلد سبلاي قبل لا يرجع كان ديكريز تو ذا ماسل، صار فيها ايديما. فالايديما هذه كأنك عرفت السويلنج الكبير هذا حصل بالإيديما من المصل يضغط على اللمب، بالتالي عبارة عن external compression من المصل على الفيزل itself which will affect the blood vessel and the nerve. كأنك عندك زي كيف أشرح؟ شفت لما لا مو بزي الدي في تي غير. الدي في تي عبارة عن it is decrease in the return of the vessel لا مو كذا، كذا كان عندك بس كذا للشرح، كان عندك ساندوتشة وبينهم في النص جبنة. تخيل لما الجبنة هذه تكون محشورة بين الأبر بارت واللور بارت، فلما يصير في إديمة راح تضغط عليها. هذه للتوضيح بس عشان اللي بيشوفها بعدين. لا واضحة؟ أتوقع بالتوضيح ده واضحة.
ايه دكتور المسلز
كذا الكومبارتمنت سيندروم كذا طريقتها. swelling is around that occur in the muscle which is around the vessel and the nerve, which will once you are not treating it, the patient will have ischemia again and will affect the nerve supply. اوكي، تبغون شيء ثاني يا شباب؟ الله يستر عليكم.
الله يحفظك يا دكتور، يعطيك العافيه، ما قصرت، شكرا لك.
يعطيكم العافيه. يلا يمديك
يعطيك العافيه دكتور، ما قصرت.
الله يستر عليكم. السلام. عبد الرحمن، عشان المحاضره اذا بغيتها كلمني. ها
الحين يا شباب نروح المحاضرة الثانية نفس الطريقة.
يلا شدوا الرحال يا شباب.